All right, let's talk about the clinical staff. How is your life going to change during this COVID precautions? All right, a handful of things I want to make sure to cover with you first off. Let's start with the meet and greet. You'll be going through the same processes and the same steps as we always have, but the real first and important thing you're going to have to encounter is the meet and greet experience. We've trained everyone how to meet and greet a patient, but now we're adding one other additional step. When families come in, we're really focused on giving them the choice of kind of the level of protection that they kind of want. And one of the key ways we're doing that is about our masks, okay? Of course, we're going to continue to use masks at all the times we need to use them, when we're creating aerosols or splatters, or times you normally have it in the office, or when you feel like you need it, all right? However, there are now these families that might want to have extra precautions themselves. So as part of the meet and greet experience, when you go to say hello to a family, if appropriate, you'll be coming out, you might have your mask on, you might then just say a quick hello or smile at the child, and then just simply ask, today I plan to wear my mask during the critical points of our appointment, but would you like me to wear it full time? Or would you like me to wear this mask throughout the entire appointment today? Kind of gauging out with that family and to see if that's something they want to do. And if that's something they desire and wish to have, then it's really simple, just to put our mask on and away we go. If they're not so concerned about it, then we can proceed with our mask maybe in the normal position like we already had, ready to go at any time, all right? So that's how we're gonna handle the mask side of things, all right? Other things we're gonna be doing, the sterile tech's job is going to be a little bit different now, because now they're gonna be doing a lot more sterilizing. We're gonna make sure we have staff in the office to ensure, as we are turning over our clinical pod areas, that they also can get turned over in a rapid fashion, okay? In our clinical areas, we're gonna have areas marked off where the families will come back. So for example, in the hygiene bay, we've got the 3 chairs lined up here that will be one pod for that family that's socially distanced from everyone else. The team of dental assistants working that group of patients will then really make sure, as they're going through their normal activities, that that family stays together. They kind of stay in their pod area, and then when the time comes to leave, that the sterile tech will come and disinfect and help clean up that area for them to make sure it's ready for the next family to turn over, hopefully as quickly as we possibly can, all right? A couple other things we're going to be doing is we're going to have our x-ray stations. Our x-ray stations will now be equipped with Lysol, so as we put those aprons on our patients and we need to take their x-rays, we then, as soon as they come off, we can spray them with Lysol and up they go again to try and create, again, sense some more sterilized feeling in our x-ray areas that they're there, okay? Now you're thinking, what about this pod system? We have families, they don't necessarily fit our areas and our teen systems, and you're exactly right. We're going to be bringing families back in groups. So what do you do? Well, we'll do the best we can. We're going to try and see that family in that group area. The one thing we might be a little challenging though is with our babies. And so when babies are part of a family, what we will do is if a baby room is available, we'll make sure they get to go into the baby room, have their typical experience. But we're now also going to be more open to having babies be seen in treatment rooms, or maybe even out in the bay if needed, if it's backed up in the baby room. So we'll start doing some of those baby presentations within the clinic, and that means that we'll make sure our baby presentations are loaded onto the computer so that treatment presentation or the baby presentation can be given in an appropriate way, all right? So in the end, what we're gonna do is we'll have these families moving from the pods in the front to the pods in the back, and then our clinical staff will handle those families. We're gonna really strive to make sure there's hopefully at least 2 assistants with each pod or each family to help each other and help coordinate and help keep things clean and turn things around. And we'll work in those tandem teams of 2 to really help make sure that happens, okay? So that'll give you at least a little bit of experience with what to kind of expect in the office when you're working in the back in the clinic, and we'll handle the problems and stresses as they come up and take care of them, all right? There we go.